Hello, I'm Caroline Wilde and I'm an ophthalmic and oculoplastic surgeon, and today I'm here with Mr. Daniel Ezra, and we are both part of the Ezra Clinic, which is one of the busiest oculoplastics clinics in the UK.
Yeah, and here at our clinic, we are the busiest aesthetic oculoplastic service in the UK, and we have an enormous range of aesthetic and clinical presentations covering the whole spectrum of advanced surgical approaches to non-surgical techniques. And we are always looking for exciting new technologies to address complex and difficult clinical problems. And I think EndoLift really fits the bill for being one of those novel technologies that is going to have a real impact on patient care.
And I think patients come to us because we specialise only in the eye area. So we have a wealth of experience. We both trained in ophthalmology before subspecialising in oculoplastics. And so we have a very detailed understanding of the eye area and the anatomy and the structures involved.
Yeah, I think that's true, Caroline. And the whole, narrative and approach to to surgeon selection is changing. I think there was a time where patients would go to a plastic surgeon for whatever aesthetic issue they had, but I think patients are realising more and more that they need to see super specialists for particular areas of concern. So if you needed a rhinoplasty, you'd really go to someone who only did noses and specialised in that area. And we're seeing that a lot for eyes. We're seeing a big shift in people really wanting to come and see oculoplastic surgeons to deal with their eye-related problems, because that is all we do day in, day out.
Yeah, and why we're so excited about EndoLift is because there aren't that many treatments for malar edema and festoons at the present, and it's a common presentation that we have to our clinic.
Absolutely, and malar edema is probably, I would say, I'm sure you'd agree, one of the most difficult things we have to deal with. Yeah. We commonly get patients with a variety of issues, but they also have this sort of malar edema, which is a collection of fluid in some of the looser tissue spaces around the cheek. The reason that forms is very complex, which I don't think we're going to go into today. I think we're going to bore the audience to death.
Yes.
But there is loose tissue there, and the normal mechanisms of the body to drain fluid are not effective in that area. And what that means is that anything that we do to induce trauma, such as surgery, means that you can get chronic swelling in that area. And equally, Caroline, as you have found, when we inject fillers into those areas, it can also exacerbate fillers as well. So we're sort of in a really difficult position when it comes to malar edema.
Definitely. And actually that's a big problem that a lot of our patients have, is that they've seen other practitioners and they have what they think are bags, and they have fillers put in that area, which just makes it worse. And then they come to us to have that sorted. So EndoLift is a really exciting technology. It uses an optical microfiber which we pass underneath the skin, and it doesn't take long, and the results are almost immediate. The risks are very minimal compared to lots of the surgical and non-surgical procedures that we perform. There can be some redness, some mild swelling, or some change in sensation to the skin for a couple of weeks, but generally it's very safe. And the results continue to improve over a number of months. Do you think that's fair to say?
Yeah, I think it is. When I first became aware of this technology, I was very excited about it because it was biologically very plausible to work. The idea of shrinking down those loose dead spaces in the tissue which accumulate the fluid was just very plausible as a potential avenue to treat this problem. But as you know, our approach is very much evidence-based, and before recommending this treatment we had to collect data, we had to look at the results and outcomes, and that's something that we're in the process of publishing at the moment. And Caroline, you can tell us a bit more about our paper that we put together.
So we have done a study of all the patients that we've treated so far with EndoLift for malar edema, which is the fluid pockets underneath the lids. And we studied these patients with 3D technology and facial mapping. And this allowed us to see exactly the differences pre and post treatment. And we found for a group of patients, it can be extremely effective at treating the malar edema.
Yeah, I've been astonished by how effective this has been for some of the patients. Now, to be absolutely clear, not everybody responds in this way, but there is definitely a group of patients who respond extremely well to the treatment. And this is important because we've never seen results like this for malar edema before. It's a completely novel approach, an effective approach, and it really helps to address this very difficult aesthetic issue that people are presenting with.
So it's really exciting. Hopefully we'll be publishing the paper soon, and we continue to collect data to see which patients do better.
Caroline, as the EndoLift lead at the clinic, can you give us an idea of what a consultation might look like for a patient coming in for EndoLift therapy?
Sure. So a patient would come to see us and we perform a thorough history of their general health, any previous treatments they may have had, and then we examine our patients. And on the back of our research, we found that EndoLift is very effective for a certain group of patients, but for other patients, other treatments may be more effective. So we will then have a long conversation with patients about what we would recommend and the risks and benefits of that. And if EndoLift is what we recommend, then we can then book that in the coming weeks, and that will be a separate process.
Yeah, it's something that we can offer quite quickly as a non-surgical procedure. We've got good availability for that, although the waits here for appointments can be very long. There's a relatively short wait for the EndoLift. And I think the nice thing about EndoLift is it's not just a treatment for the eyes, it can be used for other parts of the face and the neck, and in fact various other parts of the body. And we can offer more extended treatments as well to the rest of the face and neck as well. Yeah,
it can have very nice results in the neck in sharpening the jawline and reducing any gels, and we can perform that at the same time.
Caroline, we often have much more complex patients who've had filler injections previously and are coming in with malar edema. These patient groups are much more complex to manage and treat. Can you give us a little bit of an idea about how you'd approach something like that and what patients should expect if they're coming into clinic having had filler in the past or complications from filler in the past?
Yes, as you say, these patients are more complex to treat. So if there's filler, that itself can be the cause of the malar edema. And therefore it's really important that we identify exactly where that filler is in the tissues. And we may recommend a 3D MRI scan, which can show you the exact location of the filler, or an ultrasound scan. We then progress to maybe recommending that that filler is dissolved before continuing with any further treatment, because dissolving the filler itself can help to reduce the swelling. But once the filler is dissolved, if there continues to be malar edema, EndoLift can be a really effective treatment at getting rid of any residual swelling.
That's right, and it's important to understand that malar edema is multifactorial. Often in some people who have a propensity to develop it, the presence of filler there in itself can be enough to just tip those patients over the edge to develop that swelling. So by removing that filler, we can actually effectively improve the malar edema. It won't always go away, but we can definitely make it much better. And I think for a lot of aesthetic specialists around the UK and around the world, the management of complications and downstream problems with fillers over the years has become a real difficulty and a real area of specialism in aesthetics as well, and that's something that we do a lot of here. We have the largest series of filler dissolving injections actually in the world in our study. So we have a lot of expertise at dissolving these filler injections, particularly around the eyes, and we're best placed to advise patients regarding the risks of that and the potential benefits so that they can make informed decisions about how to take their care forward.